Hello, and welcome to New England Urgent Care Health Talks, the show where Dr. Michael Gutman of New England Urgent Care discusses important health topics that will help our community live healthier, more informed lives. I'm your host, Alex Almeida, and with me here today, I have Dr. Michael Gutman. And today we're going to be discussing a really important health topic in the community. What's in urgent care? Hi, Dr. Gutman.
How are you doing?
I'm good. How are you? So today, like I said, we're going to be talking about New England Urgent Care and what exactly is an urgent care. So first, why don't you tell me a little bit about yourself and your area of expertise?
First of all, I'm a physician, and I've been practicing for 25 years. Years have passed, and my specialty is emergency medicine. I completed an MD and PhD both at the same time in the University of Western Ontario in London, Ontario, Canada.
Wow.
They have a River Thames there too. I started training as a neurosurgeon actually, but after 3 years I decided it wasn't my cup of tea and I switched to emergency medicine, and it took me another 3.5 years to get sufficient qualification to pass my specialty boards both in Canada and the United States. At which point I immigrated here in 1995. I've worked as an emergency physician in St. Francis Hospital full-time until 2012, from 95 to 2012, and there was a 2-year stint in there where I worked in Bristol Hospital between 99 and 2001. I also joined the U.S. Army after 9/11 and was deployed 3 times between 2003 and 2008 to combat zones, primarily in Iraq. I continue to work per diem at St. Francis right now, but I devote most of my energies and time to New England Urgent Care, which my wife Yael Gutman and I started as our business back in 2011. We now run 3 urgent care centers located in West Hartford, Enfield, and Simsbury.
Wow, so you have a pretty extensive background in the emergency field, and what kind of started you getting involved in an urgent care? What is an urgent care per se?
Well, the answer is actually not that simple. Many walk-in centers or clinics use a pretty low threshold or definition for what urgent care is. They define urgent care as basically as a medical practice with extended hours beyond the normal business hours,
Okay.
with not necessarily having to make an appointment, and that's the full definition for them. However, we at New England Urgent Care adhere to a far more rigorous definition, which is set out by the Urgent Care Association of America. So that fits the criteria for achieving urgent care certification by that organization. Incidentally, New England Urgent Care is the only urgent care in the Farmington Valley, West Hartford, Bloomfield, Hartford, and North Central Connecticut to have that particular certification. In order to achieve the urgent care certification, a center must be able to offer care to a wide spectrum of illnesses and injuries, and to all ages and sexes. In other words, almost anything that's non-life-threatening, or at least not immediately life-threatening, with injury or illness that you or your family might need attending to in a very timely fashion, can be competently cared for by New England Urgent Care. In essence, it's like a small emergency department in the neighborhood or in the local community.
All right, so why would someone then choose to go to an urgent care versus a walk-in, an ER, or even their doctor?
First, let me say that we're not trying to replace your primary care physician. On the contrary, in fact, we're trying to help them.
Okay.
If you cannot be seen that day by your primary care physician, we would be happy to see you and send a report to them on our findings and treatments so that there's continuity of care. Also, if your primary care physician feels that you need care that's beyond their capabilities, such as needing x-rays, wound care, injury care, investigating more complex problems such as abdominal pain, they do not need to send them necessarily to the emergency department where they're going to be waiting hours,
Exactly.
but instead to New England Urgent Care where they'll be seen immediately. The fact that it's only about 10% of the patients who go to the ER really needs to be there. They really need to be there. In other words, 90% of the patients don't need to be there, otherwise they die. In fact, even in a busy high acuity emergency department, such as say in St. Francis or Hartford Hospital, only 25% of the patients actually get admitted to the inpatient wards. That means that 75% of the patients don't even need to be in the hospital at all.
Wow.
New England Urgent Care can take care of that 70 to 90% of the patients whose life is not threatened immediately by their illness or injury. Even when those patients need to be admitted, almost everything that would normally be done, or you would think normally needs to be done in a hospital-based emergency department, can be done at New England Urgent Care. And the patient can be directly admitted to the inpatient hospital bed, avoiding the emergency department altogether.
Wow. So are there cost considerations as well when going to New England Urgent Care, or any urgent care for that matter?
Absolutely. Coming to the New England Urgent Care is only a fraction of the price of going to the emergency department. Considering that a growing segment of the population has a high deductible insurance in order to keep their premium down, that difference is paid for by the patients. Thus, for instance, if you went to the emergency department for an ankle injury, and the charge of finding out what is not broken, which might entail an x-ray, a provider seeing you, a splint being placed, that cost would amount, or that charge would amount to $1,500. Whereas if you came to New England Urgent Care, the very same care, x-ray, provider, splint, $150.
Wow, that's
a vast
incredible.
difference. Finally, New England Urgent Care is much, much nicer than the emergency department. In other words, the service element is very much stressed. We pride ourselves on being patient-centered, respecting their time and them as a person.
Exactly. So I see that you've made a lot of good arguments for choosing an urgent care versus an ER setting for a non-life-threatening issue. But why not just go to any other walk-in center or uncertified urgent care? Like you said, there's insurance cost factors. You don't want to wait forever. And I always see walk-ins on other types of advertising saying, you know, come in, there's going to be no wait. So what's the difference?
The reason one should consider New England Urgent Care is because my physician partners and I are all board-certified emergency physicians.
Okay.
Most walk-in clinics, and even the ones that have urgent care up on their sign, are in fact run by internists or family physicians. And I'm by no means disparaging internists. They know far more than I do in many areas of medicine. However, an internist has a much narrower spectrum of care than an emergency physician does.
Okay.
So they are not comfortable taking care of lacerations, broken bones, pediatric being children, or acute gynecological issues, in other words, women's health issues. Family physicians will do some of that stuff, but they will not feel comfortable treating acute injuries and more ill patients as will an emergency physician, and they might send them to the emergency department in a much more rapid fashion than we might, and we might not in fact send them at all.
Okay.
Furthermore, any of our providers must have at least 3 years of emergency medicine experience prior to being hired by New England Urgent Care. Finally, unlike most urgent care centers, even ones that are certified, we have experienced emergency nurses rather than only medical assistants on staff during our hours of operation. The emergency nurse is expert at recognizing the very ill and bringing them to the attention of the provider and initiating time-saving investigations so that the patients can be treated and discharged faster, which is part of why our service is so rapid. And also, unlike medical assistants, the nurses can provide patient education on discharge.
All right, so it seems like it's a much more well-rounded, much more experienced staff and clientele for the clientele that's going to be there. Now, like you said, a lot of your staff is much more certified and experienced. Are there any certifications or associations that are affiliated with an urgent care?
As I mentioned earlier, New England Urgent Care is the only urgent care in the Farmington Valley, which includes Granby, Simsbury, Avon, and Canton, to have Urgent Care Association of America certification. There are other so-called urgent care centers in Granby, Avon, Bloomfield, and West Hartford who are not even capable of achieving this relatively rigorous certification process.
All right. So what does it take then to become a certified urgent care?
Urgent Care Association of America certification can only be achieved if the facility has resuscitation equipment and medications that can treat both adults and children. The provider staff must have maintained advanced cardiac life support certification. The center must be capable of diagnosing and treating all ages, including babies and most common injuries and illnesses. X-ray and lab facilities must be located and operated in the center, and it must have extended hours of operation.
Okay. And you've said Urgent Care Association of America a couple of times. What exactly is that?
The Urgent Care Association of America is a trade organization that was established in 2004. Most of its membership is American, but it has quite a few international members that include folks from Ireland, New Zealand, and Israel. The association, aside from preferring certification, which we talked about, publishes a monthly journal, organizes 2 conferences a year, and assists in administering academic fellowships for training urgent care physicians.
That's incredible. So certification certainly describes the minimum criteria necessary, but what kind of problems can be cared for and treated at New England Urgent Care?
Just about anything you can think of, we can at least initially assess, and if not, offer definitive treatment for.
Okay.
Of course, there are more common problems we encounter, such as ear infections, upper respiratory infections, the flu, and various skin infections and rashes. We are very comfortable treating broken bones, lacerations, sprains, and strains. We have on-site X-ray and immediate interpretation of the films by our providers. New England Urgent Care stocks most of the durable medical equipment you would need for these injuries, including splints, slings, crutches, walking boots. We feel very comfortable with casting as well, and if you have respiratory illnesses, we're able to diagnose pneumonia if suspected on our X-ray equipment.
Okay.
We're able to administer respiratory treatment and treat allergic reactions. We can give IV antibiotics on site, and if you're more seriously ill. As emergency medicine is our area of expertise, we are quite competent in determining if you're safe to go home or need to be admitted to the hospital. Because of our wide spectrum of care, I want to reiterate how we are comfortable with treating very young children and acute gynecologic issues.
Okay, that's quite an extensive list, and I'm sure most community members wouldn't have any idea that they could come to a place like this and such a care is provided. So what happens if a patient does in fact need to be admitted to the hospital and the situation is out of your hands?
Well, our spectrum of care stops at beyond a few hours. If you need several days worth of treatment, or there's a potential for your illness to deteriorate, we will arrange admission. We coordinate with the receiving hospital. This is really what sets us apart from most urgent cares. In most circumstances, we do most of what's usually done in the emergency department, including lab draw, analysis of the lab, X-rays, and first dose of the essential IV medication. Okay. Thus, especially if being admitted to St. Francis Hospital, though we deal with all the local hospitals, we have a special arrangement with them, and we can arrange direct admission to a hospital bed without going through the emergency department, and in so doing, save the patient literally thousands of dollars in high deductible insurance fees that come out of their own pocket, and also a lot of time from when they've been diagnosed to when they're in the hospital bed receiving their definitive treatment.
Wow, so you're helping the patient from the moment they get in and then further on if they do have to go to the hospital.
That's correct, and this is not a for business reasons. I just feel that this is a patient-centered issue, and it's the best thing for the patient.
That's incredible. So what about illnesses and complaints that one thinks they should go to the emergency department, like let's say an abdominal pain?
Well, this is what this show is really about. I'm trying to educate the public that there is most of the things that you would think need to go to the emergency department, you don't.
Okay.
Often people come to us concerned that they might have appendicitis, for example. Most doctors' offices, primary care offices would send the patient to the emergency department to be assessed for that. We would establish an IV in them, draw labs, give them IV pain medication, fluids, IV fluids, anti-nausea medication if necessary. If they feel well enough and their vitals are stable, we send them by their own car for a stat CAT scan.
Okay.
In most cases, it's not appendicitis, fortunately, but often enough it is. And when that happens, we then get that patient directly admitted from the radiology waiting room into the OR without having to go through the emergency department. Believe me, I've been in this business for many years. That shortens the course from diagnosis to definitive treatment significantly.
One can only imagine. So you mean to say that an appointment isn't needed? What if it's a Friday night at 5 p.m. and I'm hurt and I go there? Am I going to have to wait for hours? Am I have to call in advance and make an appointment?
We will be there for you. Our staff can handle heavy traffic. Even in our busiest times, people wait insignificant, very short time. We're open 7 days a week, every day of the year, Christmas, Halloween, Thanksgiving. Our hours are 8 to 8 Monday to Friday and 9 to 6 weekends and holidays.
Okay. So you guys never take a day off, essentially.
We don't. No.
So are there any other services then that New England Urgent Care offers, aside from those that you mentioned before?
In addition to the spectrum of care we discussed, we also offer workman's compensation care. We're very happy to treat injured workers without a claim number. Many physicians' offices won't see them until they've got a claim number. We strive to get the injured worker back to work in a timely fashion as possible. We also minimize, if not eliminate, the out-of-pocket expenses for the worker by offering them medications from our in-house pharmacy. Other things that we do is DOT physicals and pre-employment physicals and drug testing. So that's basically our occupational health services, and we're starting to dabble with the potential for doing complementary medicine. Okay. And offering massage and guided imagery, and that is not an urgent care service. That's more of a by appointment service. Okay,
and so it seems that you guys are treating not only the body but also the mind by dipping into that complementary medicine.
You got to have a healthy mind to have a healthy body, that's for sure.
Exactly. That's wonderful, though. Again, if you're just tuning in now, I'm Alex Almeida, and I'm here with Dr. Michael Gutman. We're discussing what exactly is an urgent care today. So, again, like I said, we're going to be helping the community learn a little bit about what an urgent care is. Could you talk a little bit more about the insurance? I know you mentioned that you guys are here to help treat, but also to help lower those costs rather than having to go to the ER.
The Urgent Care Center, as New England Urgent Care runs it at least, is in an ideal position to decrease the cost yet not compromise the care of the patients. The insurance industry recognizes our contribution to the healthcare economy. Thus, all the major health insurers encourage their clients to go to urgent care centers such as ours. They reward the clients who do so by decreased co-pays, co-insurance, and deductible costs. Okay. Medicare, managed care, and supplemental insurance is no exception. They recognize the high level of care at lower costs and thus encourage the beneficiaries to utilize urgent care over the emergency department.
So it's a win-win for all, basically. And what if you don't have insurance? Are you going to be turned away?
Absolutely not. We have very low self-pay rates, and if people have financial distress, then we work with the patients to make payment arrangements.
Wow, that's so, you guys aren't going to turn anybody away. You're trying to help as many people as possible.
We are, yes.
That's incredible. Well, Dr. Gutman, I want to thank you again for sitting down and helping the public learn a little bit more about what an urgent care is. I know many people that ask me all the time, what is an urgent care? What's the difference? So hopefully having discussions like this will help the community be more informed and know that there's someone right around the corner that can help. So again, thank you.
Thank you. And please come and visit and even just see our facilities, even if you're not sick, just to acquaint yourselves. And we're located on Hop Meadow Road, just south of the Granby line, across from Doggy in the Window. I think everybody seems to know where that is in Simsbury for some reason.
So you can get your dog treated at Doggy in the Window and then come to New England Urgent Care.
Drop off the dog, come on in.
Well, thank you again, and tune in next time for New England Urgent Care Health Talks.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.